been a journey in just patience and under leadership of Reverend Wamboi. Thank you, Rev, for just being there for us and the team, MHstar team. And personally, it has changed my life. To have that conversation that you have a family, you have people that cares, that regardless of what you're going through, there are people that cares for you. So, been every month, it's been consistency. We only missed, I think, 1 month, but every month we've been coming for all those years. So thank you for your support. Thank you for coming through. Uh, just being there for us as a team. We can't give up. We have so many things that is going on in our community. But thank you for your support. Thank you for MHstars. Thank you for everybody, all the doctors that have come through, all psychologists that have come through, the Kenyan community, the American community. So I just wanted to come and just celebrate you today and say thank you for being there for us, and continue coming, because we are not stopping. We are just starting. We are not stopping, and through Kemen, in a vision of seeing a lot of young people die in our community, seeing a lot of men just giving up and family just being torn apart. That's when I said, like, hey, Rev Omboy, how can we do this? And then she was able to be available. Thank you, Rev. I don't know how much I can say thank you to you, because when I reached out to you, you said, let's do it. And then Kevin came in. Oh my goodness. And then Dr. Nancy came in, the group, Dr. Pauline, and all the other people, Bishop Penny, just being there is amazing. Sometimes you may think you're helping somebody else, but through MHstars, my life has been changed. That when I'm going through my struggle, I know where to run to, resources, and then having a team that is available. And through having that conversation, I become better as a man. So thank you. 5 years and even more. We're going to celebrate many, many more. So thank you for everything. Kudos. Welcome to our 5th annual conference this year, 2023, and more to come. Thank you very, very much. And if Eddie's there, he can join and say something. Otherwise, I'll hand it over to Kevin to just begin officially. Thank you. Kevin, karibu sana. I can't hear you.
More math.
Kevin, are you there? All right. All right. If Kevin, I can't hear you. I don't know if somebody can hear you. Otherwise, I'll just go ahead and invite Eddie and for disclaimer. Otherwise, if Eddie is not there, Rev, you can jump in and give us a disclaimer, please.
One minute.
I can't hear you. Can you unmute?
Put the screen for today, because we want to introduce the board members, and from there I will read the disclaimer.
All right. The board members by Kevin. All right.
Okay, let us stay right there for a minute. I hear noise. Okay, good evening, ladies and gentlemen, friends from the diaspora community. Here we are. We are going to talk about mental health, and I like to say that good mental health is our diaspora community wealth, because you know that when you're in good mental health, you can accomplish your goals and your dreams, and you can also guide and lead others. Tonight, we have a very special guest. Her name is Our guest speaker today is Dr. Pacifica Mora Nyang'ao from Texas. She is a practicing mental health nurse practitioner from Texas, and I am going to encourage you that when you attend our conference, try and see if you can remember one person that you did not know before, and maybe take one idea, just 2 things, tonight or the whole weekend, because we have 2 other sessions tomorrow. Anthony Kamnau is the chairman of KMEN. KMEN stands for Kenyan Men Empowerment Network. He's also a founder of another ministry called Double Impact. He's from Missouri, the great state of Missouri. He's going to come and share the history, a very brief history of mental health stars. Okay, I am Reverend Wambui Njoroge. I am the one who loves and specializes with children, adolescents, and their families. We put their families because I cannot connect with minor children without the consent of a parent or a guardian. We have Kevin Goge. He's a nursing practitioner from the great state of Atlanta, Georgia. We should have a trivia that says that Atlanta is the Hollywood of the South, and it is also the New York of the South. So if you're from Georgia, say, woo, all, give me this, an emoji here. We have a reaction button here, so you can, you love Atlanta, we could now have all the hearts for the people who love ATL. We have Bishop Inimu there, who is our chaplain. He's also a board member. He has a PhD. We used to say pray heaven down, but this is PhD in biblical studies. He's a Christian counselor, and he has authored more than 1 book. We are blessed to have Dr. Nancy Wamba. She's a psychologist from the great nation, state of California. If you have not visited Los Angeles, you are missing, because that's one societal influencers that are in California through music, art, movies, and entertainment. At least visit. We have Mr. Eddie Kihara. This young man, he has a master's degree in IT, and he is the chief executive officer for his company that is called Edify.com. If you have a young person that needs mentoring for high school to graduate with a great grades, pass SAT and SAT, this is the gentleman to know. And you can reach him. That is his company, that is Edify.com. He helps us with IT, and we appreciate it greatly. Now, here let's get a disclaimer tonight. It should be projected, but what I did is I usually keep myself a copy in case I am the backup. Now, it's a long disclaimer. That's why I'm going to read it for this conference. Please pay attention. It's also going to be recorded. Mental Health Stars Association, incorporated in the state of Georgia, does not seek to be in conflict with any medical or psychiatric practices, nor any church, any religion, any spiritual practices, or any religious doctrines, beliefs, and practices. The information you provided here tonight is for educational purposes only. It is intended for general knowledge. The information provided here should not be a substitute for medical advice or psychiatric advice or conditions or disorders that one may have. If you or someone you know have a problem, we encourage you to seek prompt medical care for any specific mental health or psychological issues. Treatment modalities around your specific health issues are consented between you and your physician. The organization is not responsible for a person's disease or their healing or their treatment. On behalf of our speakers and presenters and moderators who have volunteered to share important information to help us raise awareness of mental health issues in diaspora, USA community where we are tonight. And we encourage and receive anyone else who is not from the USA on this platform. This platform is inclusive, meaning it is open to all people. We do not discriminate. Mental Health Stars have not charged fees this year to attend this event. And our speakers, by the grace of God, have not been promised any honorarium. This is the purest information that you can receive tonight from professionals and people who truly care for the community. And these are the same people that sometimes we reach when we are in crisis. So we are trying to prevent crisis. We are grateful for each speaker and for the audience, you individual here. So let us learn together, because mental health is not only our wealth, it is this. Protection is the best prevention. Many people are offering prevention and intervention. And I'm saying myself, I put this together. Mental health is our wealth and protection is the best prevention. So we are not going to go. And our theme is from Proverbs 11 and 14. In the multitude of counselors, there is safety. Look at us. Look at them. Look at us. The parents, the friends, professionals, all our good friends. Together, we are highly empowered and we are so resourceful. And then we live in the best country in the whole world, where there are so much resources that each person that is in need, we will help you, we will work with you to be connected with available resources in this great nation. That's what I'm going to do now. I am going to invite one of our mental health stars, that is Kevin, not Kevin. If Kevin is in, that will be okay. But for now, we want to invite Anthony come now to share a very brief history from his heart. Doesn't have to even write about it, because the vision came from his good head. Sometimes I tell him that it came from his head, which is really good. That's where many things, good things come from here. Okay, let's go.
All right. I thank you very, very much, Rev. As I shared before, 2018 was kind of difficult year, and looking and watching young people just giving up and in our community. And I started thinking, how can we be better? And then also working with the men organization, as I said before, how can you help each other? As men, there's good gossip. I always say ladies have good gossip. And also men, we need to start having good gossip. And I said, how can we have a channel as men and have a conversation so we can save ourselves and be able to have a conversation on mental health issues and why are we losing a lot of young people? So when I thought about it, and then I said, man, who do I reach? Who do I talk to about this? And then it's when I reached out to a couple of people. Rev, I talked to Rev. Rev was sold out for it. And that's where we started. So we started every month. We meet every month. And we've been doing it for the last 5 years without stopping. And I thank God for the support that we get. And we're not going to stop. As I said before, we just want to continue having this conversation, because when you have a conversation, you stay healthy. When you have a conversation, you stay clear. And I've realized that we go through a lot. And especially when we came from Africa, in Kenya, you walk, you release stress. Here, you're in the car, you are at work. What do you do? So having this conversation monthly has been so helpful. So it's been a journey, and we want to grow. We want to get better. As we end this year, we want to get better. New Year is going to even be better. 2024 is going to be better. So we want to grow with you. It's been consistency and leadership of MHstars. Without MHstars, mental health conversation, I don't know where we could be. But I thank God for this group. I thank God for their leadership, their commitment. We not only meet once a month, we meet also to organize, because without organizing, then you can't meet. So thank you so much. I still have a bigger burden that we need to continue having a conversation about even marriages. Why are so many people hurting each other in marriage? I've been asking myself that. And now this platform of MHstars and having this conference is allowing us to have those conversations, that how can we be better? Resources, and through MHstars and having these conferences, we share resources. Oh my goodness. And even tonight, just to see Dr. Pacifica here. Now I know there's Dr. Pacifica in Texas. I can tell people, hey, there's somebody who can help you, can talk to in this particular region. So welcome. It's been one day at a time. And then our slogan in Cayman is one man at a time. Sometimes you come to a conference, you're 10 people, 15 people. But what I like about us, we've never given up, because it's one person at a time, one child at a time, one woman at a time, one man at a time. And that's what keeps us going, up above all, with Christ Jesus, loving on us. So thank you. We are here for you. I just wanted to say that in what I said before. And as right now, I want to invite Kevin. Kevin, if you're ready, take over. Thank you.
Awesome. Can you hear me now?
Yes, you're clear.
All right. Great. Thank you for sharing. Yes, it's been a good journey to see growth, to sit down alongside wisdom and people sharing their experiences. It's a humbling experience, and it always comes to those tough topics that probably none of us want to talk about at home, but we try to break it down to where it's comfortable to share, to break out the ice, to take off the stigma that we have, especially having such a strong cultural and very enforced traditions from where we come from. Some of it is coming over and hurting us. Over the time, my main interest and what I'm really passionate about is young men and the teenagers. What I've seen and we share, and I always bring it up to, we want that to be comfortable, especially at the house, at home. There is a good saying that goes, charity begins at home. That's what we want to advocate for. What are some of the things that we are seeing? For my example, from a clinical perspective, when they come to the hospital and everything is breaking down, what do I see? I share. I don't break HIPAA, but some of the common things that I've seen, mine I will highly recommend, and I'm always a champion for this. Annuals, annual screening, and that's one thing that we really advocate for on my side. It tells a lot. It gives a background, it gives a starting point, it gives signals, and sometimes awareness starts from there. So it's been a journey. I'm excited to bring these conversations every month at the dinner table. Join us, come ask questions. If we don't have an answer, we take it offline and we make sure we provide those resources. Remember, Reverend Wamboy's favorite saying, he says, one life gone is too much. What can we do as a community, as a family, that one life doesn't have to be lost? We take it heavy, we have a burden for it, and it's always humbling to sit down and conversate and break these things down, and also relate to daily experiences and how people overcoming, people come in and share experiences and testimonies, and that's why we're here. I'm excited to be a part of MHstars, and we will keep on going. We have 5 years and counting. Back to you, come now. Thank you much.
I appreciate you. Thank you very much. You as a dedicated man, and just me as being a man, it's been encouraging, man, to see there's a brother that you can talk to. Sometimes I go through a situation as a man, and I'm able to call Kevin. It's because of that relationship we've had for so long. Oh my goodness, thank you so very much. Right now, I'll call upon Bishop Penny, if you're there. It's your turn right now. Thank you, sir. All right. If Bishop is not here, I want to call upon Eddie. Is Eddie Kihara here?
I think he got the time mixed up. He is logging in at 7:45, so we keep on going. Let's press on.
Cool. Bishop,
We have Dr. Wamba.
oh yeah, that's what I was going to next. Go ahead, Dr. Wamba. We appreciate you. Thank you very much for your dedication. Go ahead.
Thank you so much, Anthony, our guest speaker, Pacifica Moranyangao, and Eddie's coming, and all the mental health directors who we've been working together to bring our awareness of mental health to the world. And as Sam now said, we are going one step at a time, and we are happy even when we get one person. That person is the person that God had sent to receive that word. So, as Zia said, I was born in Kikuyu, Kiambu, eighth born of 10 children, was raised in Mombasa during my formative years, and started my educational journey at the Mombasa Primary School, later transferring to Westlands Primary School in Nairobi, where I sat for my CP then and joined the prestigious Alliance Girls High School in 1972 to 1977, successfully completing my advanced certificate of education. And I worked with Barclays Bank of Kenya, as well as the Braben School International, before pursuing higher education in the United States in 1999. I hold a Bachelor of Gerontology, minor in sociology from Mount St. Mary's College, Los Angeles, a master's in social work from California State University, and a PsyD applied clinical psychology from the Chicago School of Professional Psychology. My career is focused on mental health, but out of that, I started with the Los Angeles County Department of Mental Health, where I worked for over 10 years as a therapist with high-risk youth, adults, as well as with the elderly, navigating through all areas and aspects of life and mental illness. I'm a strong believer in community giving back and creating awareness, as I said, to destigmatize mental illness while empowering and educating patients, families, and the community in achieving and maintaining their highest functioning level. Being a part of the founding leadership of the Alliance Girls Diaspora Alumni Association as president presented me with an opportunity to further enhance my leadership qualities. Last year, I was privileged to be elected to the position of Vice Chairperson of the entire Alliance Girls All Girls Association Executive Committee. I'm also a Director of Gender Equality, Welfare, and Council at Global Diaspora One Voice Consortium, OVC. I'm also a Director of Mental Health Stars in Georgia, as well as the CEO of Jassam Traders and Bellagio Enterprises, both import-export companies, importing tea and other consumer products from Kenya to the United States. My worldview was influenced by the strong women leaders in my Wayakiwahi family, as well as my faith. I'm an active member of the Presbyterian Church USA, Presbytery of the Pacific and Hawaii, as well as Presbytery of Los Ranchos, where I hold several leadership positions dealing with immigration, missions, homelessness, anti-racism task force, and a lot more. Although based in the US, I've still maintained my strong family ties with family and friends at home, and have engaged in other projects like Wings of Love, a nonprofit organization that seeks to serve foodstuff and other needs to the needy, elderly, and handicapped without discrimination of ethnicity, sex, gender, or age. I'm also engaged in working with groups, companies, and well-wishers in providing sufficient water supply to my beloved alma mater, which is Alliance Girls High School, which has now grown to over 2,000 students in the boarding section. So all these are part of that, but my greatest desire is to make mental health as normal as possible. Like diabetes, like blood pressure, just sitting quietly because you're tired. I want mental health to be a time to relax, but the people to have the education, information necessary to take care of themselves without shame or favor. Thank you very much, and I'm looking up to all of us with the motto is what with the people, for the people, so that we can join together, God being in our midst for those, and so that we can accept and teach and acknowledge that those who have mental health issues or substance abuse issues are not forsaken. They are not taken elsewhere, that they feel part of our community. And with that, looking forward to issuing, talking about the elderly. As I said, I'm a gerontology major, and I look forward to discussing a few things mental health related that also occur in the seniors passion. So with that, as you can hear, I'm a babysitter too. That's my other specialty. And we will get together and discuss all this. Thank you, and God bless you.
All right. So appreciate it. Thank you so much for your support. You've been consistent. So much love. Thank you very, very much. Your expertise is always appreciated. Thank you very, very much. It's all about dedication, and I appreciate you for that. And for right now, as for now, I'll invite someone that has been there for all of us, someone that has kept us going. Her leadership, her dedication is priceless. She's always on point. I'm like, man, where do you get this energy? And she's always like, how is one guy doing? You know, when she calls you, when you have a conversation, like always thinking about your family. How is one guy doing? How is your family doing? That means a lot. And thank you for your leadership. Thank you for not giving up on us. We are not perfect. Thank you for loving this generation. And thank you for your love. I don't know what to say. And as right now, I invite Rev Wamboi. Thank you so very much for helping our community. Karibu sana. Asante.
Thank you so much. It has been my distinct honor to serve with the men and the women that are concerned about the welfare of families. I am just going to go straight and let you know that this is Say No to Depression. Depression is an affective disorder that impacts physical, mental, and emotional health. It often interferes with everyday life, causing suffering for both those who with the disorder and those who care about them, especially family and friends. So unlike normal experiences of loss and sadness, depression is characterized by intense, enduring feelings of hopelessness and helplessness. So you can't tell someone who is depressed, just get over it, because they can't get over it. Simply say, depression is not a bad mood. People affected by depression are not weak, nor can they simply wish or will their condition away. And that's why we come here to talk about it, because there is help. STARS stands for Start Talking About Mental Health or Mental Illness and Remove Stigma. Like someone has already said, think about it like someone with diabetes or a child who has ADHD. Do you tell them that just get over it? They don't get over it. Sometimes if things are left alone, they can go from bad to worse. Quickly, what causes depression? We are not going to go into great lengths about what the causes are. We do that the whole year. But I want to say that it can be caused, several factors can play a role in the onset of depression. Sometimes we say in lists that variables, many. Vulnerability to this illness results from internal factors within you, like your body chemistry and physical health and heredity acting together with external factors, like like what happened in Maine now. There are external factors of the people who have been affected by the issues that are happening in their community. So there are chemical causes, there are physical causes, there are genetic causes. Let me dwell on this because this is very pertinent for diaspora community. Some people may have a predisposition for affective disorders, and people with family histories of depression have an increased risk of developing it. But heredity does not, repeat, does not automatically mean that you are going to be affected, because there are some things that we can do to help ourselves. Now, since my area of focus is children, allow me to just say some little things, just 2 things about children. I wish I can also say about women, but maybe as we go on, we'll say that. I want to say that it may be difficult to determine whether a young person is suffering from depression or just going through a phase, especially our children that are school age. Why? Because they're also developing. So sometimes you have to allow for development. And it's really, really hard. Where I have worked in the school communities, it's really hard. For example, if you have a child with ADHD, if it was my school, I would wait until this child is 7 years old. You see what I mean? Before prescribing any medication. But I thank God we have a doctor in the house, and the doctor is going to correct Miss Wambui, okay? Because a young child needs several things, especially in this country where I worked. I was like flabbergasted. I was like, how can the school be so enclosed? You know, my school back home was called PCEA, Keno Primary School. Now it's called Mamangina Kenyatta. My goodness, I wanted to go to school so bad because we were playing all the time. Hello, going outside. You know, that was the best time with my friends. You know, we are coming from the same village. We talk, or we wrestle, we run, we work out our energy. So when our bodies are tired, we go back to the classroom. Now we can study. Now in this country, the kids were always indoors. And you know what? My classes, they had windows. Sometimes we looked out. In the USA, many schools, they are enclosed. My goodness, that for me was not even healthy for me as an adult. I had to get used to it. And I insisted and asked the school all the time, do you have an office with a window? Everywhere I work, I ask for an office and a window. Maybe I might not even work there. If there's no office, you know why? I want to look outside because that's how I grew up. So children, it's really hard to diagnose children because they are going through a developmental phase. A child with depression may have a hard time coping with everyday activities such as going to school. That can be a huge drag. The child may throw a temper tantrum, pretend to be sick, or change eating or sleeping habits. The very basics of life. Eating, you know, having a good appetite, going to sleep, going to school, things we may take for granted. If a child in your care shows up with this type of things regularly, you need to check it out a little bit. Now, my favorite group, and it's the hardest group, and you will love it. When you fall in love with this group, you will never want to talk to any other group. These are teenagers. But we'll leave those to Mr. Kevin. But I'm just going to say this. A teenager with depression may have problems at school or refuse to participate in social activities. Depression in teenagers may also be coupled with an eating disorder, substance abuse, aggression, or neglect of personal appearance. Treating depressed young people is important in order to prevent them from becoming depressed. May I tell you that if you know anyone who has young children, we have all the resources in the school system. Imagine, we even have a resident nurse. We have a resident social worker. And when I worked there, they're going to have people like me back. That time, we were trying to bring mental health to the school systems or other communities in school. I worked so hard in 10 counties selling the idea that if we bring mental health to school, we can reduce the number of days anyone is out going for the appointment. Because some of the things we are talking about, like mental health, sometimes illnesses, they can be like a lifestyle disease, meaning one may become what we call a maintenance client, meaning you will see a doctor more than Wambui or more than Kamau. You will see a doctor for maybe once in 3 months, maybe monthly. While Kevin said we just need a physical, not just need, but we need a physical, but someone with a lifestyle disease or chronic that is not just going to go away. So they frequent the hospitals more. Anyway, I did not win that time, but I am so happy it is working now in most schools. They are looking for mental health workers, associates, technicians, people who understand to help our young people. So we have a lot of resources. This is what I'm saying. I put my name with my message. I am from South Georgia. We say like this: you walk the talk. I'm going to give you my word. If you ever need a referral and you're having a problem, whether in school or in the hospital or anywhere in the United States of America, even Kenya, I can call. I am here, and if someone will not listen to you, I will talk to that person and persuade them. Then I will partner with you, maybe for a short time, to explore and know what resources are available for our young people. Yes, I say one life of a young person, okay? One life of a young person that is lost. It is one generation too many, because this is the person that we are handing the baton of mental health. Yeah? Two, when we are not around, somebody else will carry this message. Thank you very much. I can talk like this the whole day about children. Sometimes I tell people I am not even going to read because it's like in my heart. So I love young people. It is the group that I have worked everything I have ever done, from Sunday school, being a superintendent of Sunday school in North Dakota Parish, since now people are saying where they come from. And then youth, Tehumo youth, wherever young people are, I go. And then in this country, I have been honored. I have taught other things like academic skills. I'm the one with the college and career, and social skills. I don't want people in any trouble. And when I come back tomorrow, I'll give you 3 keys that will help my students. I call them my students because when they succeed, I feel I am successful. Thank you so much.
Okay.
And we are getting ready. Breathe in, because it's good to transition. We are getting ready to have only one presentation from Mr. Eddie Kehara, if he is here. He is coming from Atlanta. Atlanta traffic like today. May God have mercy. It is so heavily traveled. And if he's not available, maybe during the questions and answers, let us encourage you. Do you see this reaction button on your, since now we are in this curve. We are not learning now, we have been on Zoom. So now, raise your hand if you have a question. After our speaker has spoken, we're going to have time to ask questions, and then you can lower your hand. If I say something that you really like, like now you could have just given me a heart. You did good. I like affirmations. I am going to say, Mr. Kamna is doing a good job, and Kevin too. So use the reaction button. Another one, you can use the chat. Thank you, Wangai. Come on. I love this young man. Okay. Here we are. We have a chat. Please put any info, any questions or comments that you think are good. But if they are kind of, oh boy, you did too bad, DM me, or rather direct message me, okay? Sometimes we just using this acronym DM, and I'm like, okay. Thank you so much. Mr. Kamnao, you got the mic again. We'll call on the speaker or Mr. Eddie, whoever is available.
All right. Hi, everybody. Thank you, Rev. I don't know if Eddie's here. Eddie, go ahead. Otherwise, if Eddie's not here, I will request Eddie's coming in. Amen. Mr. Eddie. Mr.
Okay.
Eddie, it's your turn. Go ahead.
Let's see.
Welcome, Mr. Eddie.
Yeah, Mr. Eddie is going to tell us about, he has been with us from the very beginning. He has been so helpful. Welcome.
Hello.
And I'm the one who gave him the wrong time.
I'm so sorry, y'all. My apologies for my tardiness, and greetings to everyone.
Yes, I have questions for Mr. Eddie. Well, who are you? Yeah, tell us who you are.
Well, my name is Eddie Kihara, and first and foremost, I am a believer and follower of Christ, redeemed by the blood of the Lamb of Christ. And I am an instructor for SAT, ACT prep. I'm based in Marietta, Georgia, and that is what I have to say. That is, I think, what encompasses who I am pretty well. Wouldn't you agree, Reverend Romboy?
Yes, I was. What is your company's name?
Right. My company's name is called Fast Choice Tutors, and I work with students aged from 6th grade onwards up until college. We focus on math tutoring. We also do SAT and ACT test prep. But my educational background is in the field of IT. So that is the capacity on which I'm here to lend a hand and be with these amazing people and help support today's forum. Thank you so much for having me.
Thank you. We are going to ask you that this is being live taped directly to YouTube. And we have our speaker today. She's ready. She's looking good. This is Dr. Pacifica Nyang'ao from Texas. She's going to talk about psychotropic medication. And I always have questions myself. I don't know why, at this rate, I am a student. And whatever I learn, I reteach the whole world if I can find it. Every week, I share something with the whole world, wherever they are. So that's why I love to sit down and listen to a doctor. And I thank God that she will correct us where we are. But I want to also add that we are informed by best practice. Myself, I don't like folk therapy. I don't like people in Kenya saying that, oh, this is a generational curse. I might actually say that these are patterns in your family that we need to interrupt. I don't like folk therapy for some reason. But anyway, that's why I'm so happy for the doctor to come and help us understand, because many people reject mental health because they are afraid they are going to be prescribed medication, especially immigrants, because we are new. My doctors, most of my doctors in Kenya were like me. They were Africans and they were Indians. Then I came here and this American lady told me, when you get old, you're going to look like your grandmother. I was so upset. I said, have you ever seen my grandmother? Have you ever seen my grandmother? And actually, she was so wrong. Wrong. Like, you live in North and she's talking about the South and she has never been to the South. So I said, have you ever seen my grandmother? And then I went on and saying, how about my auntie? You never seen my aunties? And luckily, by grace again, I have an older sister here. It's a good reference, so I didn't like it. Dr. Pacifica, welcome. We are waiting for you.
Thank you. I hope you can all hear me.
very clear.
Okay.
Yes.
And you can all see me because I want to be an actual somebody, not a robot behind the screen.
Yes, we see you.
And I'm not sure how you want me to do the presentation, if I need to share the screen, or I can just go ahead and talk through my PowerPoint. So
we can share the screen with you if you want to use the screen like this shared. Yeah, it's enabled now for multiple sharing.
It's okay. I don't have to share anyways because I'm one of those people who never close anything I browse. But if you can share, maybe people will follow through my PowerPoint.
Okay.
And technology is not my specialty, so if I can figure it out.
We'll make Eddie is a co-host and he'll help us, right?
Yes, please.
This is Eddie. He's not a robot. He's real.
Yes, indeed. Would you email me the presentation, or did you already email it?
Maybe email. Yeah, let me do that.
Okay.
What is your email?
Let me post it in the chat. Let me text it to you.
You're not a co-host.
Okay, thank you.
And yeah, the screen sharing is enabled at this time.
Got you. Dr. Pacifica, I have texted you the email address on the chat. Do you see it pop up on your screen?
On the chat. Okay, let me see. Okay, yes.
As you're waiting, Dr. Pacifica is a mom and she is married and she's practicing and she has volunteered to be with us this evening.
Thank you so much. Appreciate your time, Dr. Pacifica Nyangao.
You're welcome. You're welcome. All right, I'll send it to you.
Wonderful. Okay.
Yeah, I'm gonna click Instagram.
Okay.
Yeah, you got it?
Yes, I believe I have it. Just a moment to load it. Okay. Let me now share the screen with everyone. There. You have a visual, everyone, of the document. So, Dr. Pacifica, ready on your cue. Just let me know when you're ready to move from slide to slide.
All right. So my name is Dr. Pacifica. I'm a psychiatric nurse practitioner with a doctorate in psychiatric mental health. I am the owner of Equanimity Behavioral and Consultation Services. That's my private practice here in Texas. We can move to the next slide. So what are psychotropic medications? These are medications that have effects in the brain, and they work by affecting emotions. They help with anxiety, depression, mood swings. That will include people with ADHD or kids with ADHD that have lack of focus and concentration or aggressiveness. We also have medications that helps with sleep issues. We can move to the next. Now, psychotropic medications, they are categorized in different classes. And they are classified based on how they work or what they do or what they are used for. And so with that being said, we have antidepressants, which are used to treat depression, anti-anxiety medication or anxiolytics, and those are used to treat anxiety, antipsychotics for psychosis and other mental health diseases like depression. We have mood stabilizers. We have sleeping aids or stimulants. And stimulants mostly are medications that are used for ADHD. We can move to the next slide. So my first psychotropic class of medication that I want to talk about is the antidepressants. And antidepressants are categorized in we have a serotonin or selective serotonin reuptake inhibitors, and it's a kind of complex to say selective serotonin reuptake inhibitors. What does that mean? It means that those medications, they inhibit or they block the serotonin instead of after serotonin is released from the presynaptic nerves, it blocks so that there's more serotonin in the synapses, so it can be used to transport neurotransmitter or what we call messengers. Now, under that selective serotonin reuptake inhibitors, the most commonly used ones are Prozac or fluoxetine, Cymbalta, sertraline, Lexapro, and Celexa. And they are mostly or commonly used because they have at least less side effects. And all of them, they come with different side effects. I do have a side effect on the right side. I don't have to read through them because of time. The next class of medication is what we call tricyclic antidepressants. Those are older generation ones. They tend to be more effective, but they come with more side effects or severe side effects. And I have Elvir and Pamela as some of the medication in that class. We have serotonin, norepinephrine reuptake inhibitors. And those, they work by basically increasing the serotonin and norepinephrine. And we have Effexor, Cymbalta, and Remeron. Now, Remeron also, I like using it, especially if we have patients who have poor appetite and sleeping issues, because it can boost the appetite and helps with sleep, besides helping with the actual depression. The next one, the Wellbutrin. It's my to-go medication. If somebody comes to me and says they have they don't have motivation, they don't feel like getting out of bed to go do anything, because what it does, it boosts the dopamine. Now, with that being said, we can move to the next class. Next slide. The next slide will talk about anti-anxiety medication. What is anxiety before we talk about the anti-anxiety medication? That's when, people complain about they can't relax their nerves, or they feel like, they cannot calm down, they cannot relax. They feel like there's a knot in their abdomen. So the anti-anxiety medication, it helps to calm or relax their nerves. And how they work, they, especially the benzodiazepines, which are the Valium, Xanax, Ativan, and the clonazepam that I have over there, they helps to increase the frequency of GABA channels, like how frequent they open, so that they can increase the GABA in the brain to help to calm the nerves, basically. And those class of medication, the benzodiazepines, also they are used for seizures, or to help if somebody been drinking alcohol and they go like cold turkey, instead of them having withdrawals, they can get some benzodiazepines to help with the withdrawals and seizure from that. But this kind of medications, they are not approved for long-term use because they tend to cause addiction, and people tend to depend on them. They do have side effects, dizziness, sedation, dry mouth, addiction. I talked about that. One of the things also that it causes, with if you long-term use, it can cause cognitive impairment or confusion and depression with the long-term use, because if you depend on it and if you can use it frequently, then you can start feeling sad and feeling depressed. So it's not really my to-go class of medication, especially if there's something else that can be used in that category. But they are, effective. So they are available for patients to use, because if that's the only thing that works, then hey, better get it than suffer. We can go to the next slide. We have antipsychotics. These are medications used to mostly treat schizophrenia, because that's where we find patients having psychosis. That's like hallucinations, hearing things, hearing voices, or seeing people, or seeing things that don't exist, being paranoid, thinking like people against you or people after you. And also they are used for severe depression, or patients with bipolar, for mood stabilization. This class of medications, they are categorized into two. We have what we call first generation antipsychotic, or typicals, or second generation atypicals. Now, with the first generation, they have their own, kind of side effects, which affect more neurological. And then at the second generation, affect more of like metabolic. That's where we get like gaining weight, high cholesterol. But it doesn't mean metabolic side effects are less severe than the neurological ones. By the end of the day, it's like what is really working best for a patient. And monitoring blood work to make sure if something or a side effect is going on, we are able to catch it on time. Then we can move to the next slide. I don't have to go through the side effects over there. We have mood stabilizers. Mood stabilizers mostly used for bipolar disorder because that's where patients are experiencing mood swings, up and down. But when you use the mood stabilizers, sometimes they work, just mood stabilizers alone, or you have to add an antipsychotic to it to help to stabilize the mood. And people will be like, oh, these medications I've had, they are used for seizures. Yes, mood stabilizers, they're anti-seizure medications that happen to treat mood issues. And those are like a Depakote, Decretor, lamotrigine, Trileptal, and lithium. Lithium is good, especially if somebody's having a severe manic episode with suicidal thoughts. The only catch with it is it has like what we call narrow therapeutic window. So monitoring the drug level, it's really highly mandatory. You can say recommended is like mandatory, because otherwise it can cause severe issues like liver problems if it's not monitored carefully. But those are the medications that I really use to stabilize the mood, especially for people with bipolar disorders. And we can move to the next slide. Now, we have sleeping aids. Sleep or lack of sleep, it's an issue. But it shouldn't be an issue, especially if somebody has tried what we call sleep hygiene, like going to bed on time or at the same time earlier, going to bed, not staying on electronics. We're in that generation where we want to have the phone, the computer, everything up to the minute we're in the blankets, and that causes what we call blue light stimulation. But if somebody really have these other issues, depression, anxiety, bipolar, they're going to have true sleep issues, and that's where these medications they come in: the Ambien, Lunesta, Restril. We have more. I just had to use or put a few of them here because it's a long list and we don't have much time. But if you're suffering from sleep issues, know there's help. All right, we can move to the next slide. The next slide, or the next class of medications that we have, they are called stimulants, mostly used for lack of focus, lack of concentration. That's for people or kids with ADHD. They also have what we call addiction and dependency issues. Especially, I don't see it more, for the kids section, but more to the adults. And they do help because if somebody has true ADHD, they cannot be able to complete their tasks. They cannot be able to stay focused at work. It affects their job production. That will cause anxiety because somebody's always worried, oh, am I going to lose my job? Then that causes depression. So if somebody needs it, they have help. And they have their own side effects: trouble sleeping, dry mouth, increased blood pressure, or loss of appetite. And that's why a lot of people like it, especially if they are struggling to lose weight. Hey, why can't they go get some stimulants so they can help suppress their appetite? But that's not really the use or the intended use for it. The intended use is to help people with focusing and concentration. And we can move to the next slide. And that next slide is the references. I don't know if I went too fast or too quick, but that gives us time for questions and answers. Thank you. Back to you, host.
Yeah, Rev, you want to take over? Thank you so much for the pointers. Somebody's asking the question, can you post the sliders later? I don't know if that's okay.
Yeah.
Also, it's gonna be on YouTube. So maybe we can share with you after the question, the person who has asked. In the meantime, is that not good? But I was glued to you as right. I'm thinking the side effects. Maybe I'm like, I don't know. Can you say something about that we need to be aware of concerning side effects?
Yes, so each class of medications, they have different side effects. Okay. And with these side effects, really everybody experiences side effect differently because it depends on how somebody's body is metabolizing the medication. It doesn't mean the same side effect I'm going to get will be the same side effect somebody's going to get. In fact, I've even had patients who get side effects that are not even in the book. And some don't even experience any side effect. But those are the common side effects that I always educate my patients. I tell them, if you experience this and this and this, let me know. If it's life-threatening, like you can't breathe, you can you're having like maybe a severe skin breakdown and you can't breathe, like a medication like lamotrigine, that's a medical emergency. However, some of those side effects really they don't happen to each and every person.
Okay. Thank you so much. I like your presentation, although the words are like, okay, I do not remember anything, but thank God it's been live taped. So we want to give an opportunity to our audience to ask questions. I'm concerned about something I read a long time ago. Like when you first introduce medication, is there a difference between white people and Black people or Caucasian people and Black people, so that if you give me the medication, the full dose, like you give to somebody else, is there any difference? And this is good because this is where we blow out the myths and we will live here with good information that can help us. And I want to ask the audience, if we stopped live taping at this time, since we have gone through the most important areas, would you be more free to ask your personal questions? So if they are not recorded, I like to work with you. This is me asking. And if I can get 2 or 3 people to record, we keep recording or we turn off the live recording, because this is a very informative session in case you have personal questions you want to ask. For example, yeah. Do I have?
I think we can stop going live. Then people can have that freedom. I don't know if that's okay.
Okay, one. Do we have two other people that is the audience? Stop the live recording, okay? One other person? Okay, we have okay there. Let's conclude this with a commercial, and then when the commercial has aired, then we are going back. We're coming to ask questions. So that will be free. Nobody's gonna record. It's not gonna be on Facebook. It's not gonna be on YouTube. You hear, you take your own notes, and I like that. And it's not even gonna be on Google. Ha! Yeah, those opinions of Google. Unless you give Google that opinion. Is that good? I like to be free myself. In this day of monitoring everything. All right. Do you have a commercial, Mr. Eddie? For Edify? If not?
Yes, I can let me share that with the audience. Thank you for the opportunity.
Yeah, share a commercial. When the commercial is concluded, we'll go to audience Q&A.
Greetings once again, everyone. My name is Eddie Kihara, and I just want to share with you a website that we've created to help students, mostly juniors and high schoolers, prepare for the SAT and ACT. Now, this is a fully digital version for people who are not able to come to a brick and mortar in Marietta. You still can have access to a quality preparation platform for the SAT and the ACT. Now, is this visible to everyone on your end?
Yes.
Okay, wonderful, thank you. And what this is, we have short form or short version video lessons for students to be able to review important concepts in math or English, and they are laid out in short format, as I mentioned, 5 minutes, 4 minutes, and each of the lessons culminate to a section of practice problems where they can practice real test questions from the past, and they can drill and repeat leading up to the day of the exam. And we do two main examinations, the SAT and the ACT. We have reminders that are sent out to the student. There's a calendar for the students to follow. For students who have a hard time managing time, we have a calendar that reminds them what to do on every specific day. So we have two different calendars. They can take a 6-week course, a 6-week plan to prepare, or they can take a much longer plan where they make their own times to study. The name of the website is edify.co, and that's edify spelled with 2 Ds, .co. And for anyone who is in this forum and would like to have a test run for their son or daughter who is in high school, just drop your name and your email on the chat, and we will gladly reach back out to you and give you some time for you to maybe give it a test drive. If you like it, then you'll have an opportunity to hop on and purchase it. Are there any questions maybe that I can briefly answer concerning this commercial? All right. Seeing that there aren't any questions, I'm going to hand it back over to you, Reverend Omboy. Thank you for the opportunity.
Yes, at this time we are going